we're going to have a wonderful afternoon of speakers. We have Jessica Nielson next. Dr. Nielson is currently gathering preliminary data through an anonymous online survey to assess user-reported risks and benefits of the ayahuasca experience in various ceremonial and alternative contexts, specifically related to the treatment of PTSD in trauma survivors. And as I was reviewing Jessica, her background and work, I came across a video of a preliminary 3-minute snippet of her upcoming talk at the MAPS Psychedelic Science Conference coming up in April. And in 3 minutes, she described her research a bit, but in such a disarming, sort of a laid-back way that was so different from the background I just read you. So this is a little bit of like the Venn diagram overlapping of both incredible talent and incredible groundedness and maturity. So I'll turn you over to Jessica Nielson.
I'm really honored to be here today. I've been fascinated by psychedelics for a very long time, and I've been trying to break out into this field since I received my PhD, and I just feel absolutely honored to be up here with some of my heroes and pioneers in the field of psychedelic research. And so thank you so much for inviting me to be here and for coming to listen to my talk today about ayahuasca for PTSD. So a brief overview about what I'm going to talk about today. First, I'm going to talk to you about how sort of the unconventional way with how I became involved in studying ayahuasca for PTSD, since it hasn't necessarily been my training or background. My background is actually in basic neuroscience and spinal cord injury, so it'll be an interesting story of how I got to where I am today, standing in front of you talking about ayahuasca for PTSD. Then I'm going to talk about sort of the rationale of how ayahuasca might be an effective treatment for post-traumatic stress disorder. Then I'm going to walk you through some of the preliminary results from an anonymous survey I've been conducting since June of this year, assessing risk and benefits from various people's responses who've taken ayahuasca to treat PTSD as well as other conditions. And then I'll give you some ideas of the next steps and where I see the future of ayahuasca research happening in the United States over the next 10 years. So how did I get involved in ayahuasca research? So I started graduate school in 2005 to do basic neuroscience research in a learning and memory lab and a basic neurotrauma lab in animal models. And in 2008, I went to Burning Man, and I actually saw a series of lectures by MAPS talking about all the different psychedelic research that was happening in the United States at like UCLA and Johns Hopkins, and I was just floored. I couldn't believe that this was actually something that was happening in the scientific arena, and it was potentially something that I could be involved in and do myself as somebody working towards a PhD in the neurosciences. Let's see. So in terms of getting into how I actually started doing ayahuasca for PTSD. So I first went down to Peru in 2010 to take ayahuasca for PTSD. It's a little bit of a convoluted story if you'll just bear with me for a minute. So when I was in graduate school, like I said, I did basic research, which means you basically do animal research on whatever your disorder is, and my disorder was spinal cord injury. And I felt very shameful and traumatized about having to work with animals. I really didn't like it. I didn't see what the relevance was for humans. When you're stuck in the lab, it's hard to see kind of the bigger picture perspective of why you're doing what you're doing. And every animal I had to work with was just absolutely terrifying for me. I always kind of personalized it a little too much and would sort of feel like, what if I was the test subject? Would I want somebody doing this to me? So I had a lot of ethical issues and moral issues around what I was doing. By the time I finished my PhD in 2010, I actually wanted to leave science. I didn't want to have anything to do with science anymore. I was really kind of just sick of the whole thing, and I didn't like the way that it was done. So a friend of mine told me about this center that had just opened up in Peru that was offering to send people down to Peru to take ayahuasca if they couldn't afford it, if they really needed the healing. And so I submitted a video testimonial, basically outlining my situation and why I wanted to take ayahuasca for my own situation. And luckily, I won one of these trips. And so I was like an all-expenses paid trip, thankfully, to go down to this center. It was 10 days in Peru. And I won't go into the details of my own personal journey. I did find some catharsis and healing from the shame and trauma that I felt about doing animal research. But what really impacted me when I was down there was I just happened to serendipitously be there doing ceremony with a bunch of veterans that had PTSD. And when I first got to the facility, I was actually admittedly kind of afraid of these men. They were just these big guys that seemed to be, they had a lot of problems, and I was a little nervous being around them, but kind of watching them soften up and watching them heal and seeing that transformation that they went through because of taking ayahuasca really motivated me to get back into the research field, come back into science. I went back to the United States and was like, how am I going to research this in my career? And so I wasn't a clinician, I wasn't a psychologist, I had no idea about any of the science of ayahuasca, of which there's a rich literature. And so I ended up taking a job at UCSF in 2011, sort of working in my same field of spinal cord injury, but actually, just as an aside, working on collecting data from other people that have already finished their studies so we can create these huge animal repositories that we can use to answer our questions rather than answering them in animals. And so I've been really excited about doing that, and it keeps me funded and it keeps me employed, but it's not actually what I want to do in the long term. I want to study ayahuasca for PTSD, obviously. So one of the first things I did when I got that position is I reached out to Rick Doblin at MAPS. And I just sent him an email and I said, I just got back from Peru, I took ayahuasca, I see how effective it might be for PTSD, how can I get involved in this research, what do I need to do? And he was like, well, we don't actually have anything going right now looking at ayahuasca research, particularly for PTSD. Our focus is MDMA. However, it's funny that you contact me right now because maybe a week before that, he had been contacted by National Geographic. And they were looking for somebody to follow down to Peru to monitor some people with PTSD that wanted to take ayahuasca. It was for this TV series called Drugs, Inc. And it was a series, this specific episode was focused on hallucinogens and the therapeutic potential that they had. And so I felt very fortunate to be able to be part of that. And so I went down to Peru. They sort of had me listed as the expert in this documentary, which I thought was kind of funny because I was, just had my PhD awarded to me and I had no real experience in this field other than a desire. But I was happy to serve that role for the purposes of that project, and it opened up a dialogue between me and Rick Doblin so that we could continue our conversation about how to study ayahuasca for PTSD, because it was something and is something that he's also very interested in looking at. Through our conversations, I wanted to get my name out there of proposing this idea of ayahuasca for PTSD. So I actually asked Rick if I could submit an article for their bulletin that they put out a couple times a year, just sort of proposing the rationale of why I think ayahuasca would be useful for PTSD. And he let me submit an article, and that was really great. And I submitted it with a colleague of mine, Julie Megler, who's a psychiatric nurse practitioner, because I don't have any psychology training officially. I really wanted to bring a psychiatry professional on board that could help me sort of understand the psychological aspect of trauma, because I was really well versed in the physical complications of trauma, but not the psychological components. And then from that, I was asked to speak at Psychedelic Science in 2013 about a similar topic. And so just let me walk you through sort of the rationale of why I think ayahuasca would be a really good treatment for post-traumatic stress disorder. Just to give you some background about PTSD, for those of you who don't really know a lot of the details about what PTSD is, it's essentially a maladaptive coping to a triggering event or traumatic event. So it's normal to have strong reactions to life-threatening situations. Normal adults have a decrease in these reactions when the threat is no longer present. PTSD patients, however, have a persistent reaction even when the threat is gone, and they develop unhealthy coping mechanisms that exacerbate psychopathology. So just a little diagram of how PTSD develops. There's lots of different sort of ways that PTSD can manifest. It's very complex. There's a lot of different things that can influence how someone is going to react to a traumatic event. So let me see if this works. Yeah, so if you just follow my cursor. So there's a lot of things that will predict how somebody responds. And so there's all these pre-traumatic risk factors that are very well documented in the literature that sort of influence what's going to happen after this traumatic event happens. And these could be things like socioeconomic status, genetics, medical history, comorbid conditions like depression or other psychiatric disorders, gender, age, etc. And so all of that sort of feeds into how someone responds to the traumatic event, and then what happens after that. And so in normal people, in the blue line that's heading up here. Normal people will have resiliency to this trauma. They'll feel an initial threat, an initial sort of disturbance, but then they'll have normal adaptation and then they'll recover and they won't develop PTSD. Some people will develop PTSD, but then they'll have some responsive to treatment, and this has really helped when they have good social support systems in place. Persistent PTSD happens when someone develops maladaptive coping mechanisms such as addiction or isolation or withdrawal from their social circles, and so that will lead to the persistence of the symptoms. And then there's this fairly new idea called complex PTSD, which happens when somebody is in an ongoing traumatizing situation. So, example, like if you have an abusive spouse or you live in a war-torn region, or if you're in a violent urban area, it's really hard to manage someone's PTSD when they're continually being re-traumatized. So just, I'm going to briefly go through this. This is just sort of the physiology of how the brain responds to different stresses and how PTSD kind of gets out of control. And so in normal control, this is sort of the limbic system and how it's activating the HPA axis, which is involved in our sort of adrenaline fight or flight response. And so normally, if something happens in the amygdala, in the hippocampus, say you think of something that's a little scary, it activates the amygdala, which activates the HPA axis, which in turn will flood your system with adrenaline. And that's your fight or flight response. And normally when that happens, that surge of adrenaline will cause inhibition of some of these upper regions in the brain that will then shut that system off so that you no longer feel triggered. In PTSD, however, there's sort of a dysregulation of this where you'll have these psychogenic stressors, which could be, a triggering memory or a thought or a fear, or you can have a physiological trigger, just some imminent physical threat in your environment. And what that does is it causes a hyperactivation of this HPA axis where it's unable to sort of auto-regulate itself and shut down that adrenaline response. And so you get this like constant influx of this circuitry that's sort of keeps sending the stress signal to the limbic system. And actually in PTSD patients, this becomes so severe that you see things like hippocampal atrophy where the hippocampus actually will shrink. And this can cause substantial cognitive deficits in patients with PTSD. So some of the effective treatments for PTSD so far, other than MDMA, are SSRIs. So what they do is they act to sort of reduce that amygdala response that will activate the HPA axis. And there's also a cognitive behavioral therapy, which is really useful because it helps someone sort of recontextualize the way they think about their trauma. And another interesting therapy that is out there that is effective but can be somewhat dangerous is exposure therapy. So you basically expose the patient to what was their traumatic event and sort of try and have them re-experience that, but do it in a safe setting so that they can deactivate that circuitry that's causing this like hyperarousal all the time and hopefully return that system to baseline where then they can have these sort of triggering memories, but then they won't cause this physiological adrenaline fight or flight response. Okay. So the hypothesis here regarding ayahuasca is that ayahuasca sort of mimics SSRIs pharmacologically, and that it also experientially kind of mimics exposure therapy. And the reason why I think ayahuasca might be useful but potentially dangerous for PTSD is that exposure therapy in someone with really severe PTSD could actually be re-traumatizing. So it really needs to be set up in a really safe and supportive way so that the experience itself isn't re-traumatizing for the person. And so we want to make sure that that is going to be the case moving forward, looking at it as a potential therapeutic for PTSD. Okay. So there is quite a bit of published literature on the therapeutic applications or indications that ayahuasca might have for various conditions. So most recently, I don't have it up here actually, but one of the first studies that came out was from Charlie Grob in the 90s looking at ayahuasca and able to treat alcohol addiction. And so they saw people have decreased alcohol use following ayahuasca, and they had a controlled group in that study. More recently, it's been shown to have some efficacy in drug addiction, the caveat being it was a small pilot observational study, so only 12 participants in the study. But they did show significant effects of decreased substance use, as well as qualitative measures of psychological and behavioral function that were also improved. There's some evidence that it might be beneficial for cancer, but there hasn't been actually any studies on this. This is sort of a meta-analysis that I found in the literature about ayahuasca being used for people that have cancer, and there's just been these sort of positive case studies that have come out of that were reviewed in this paper in 2013. And then there was a couple studies that came out in the last 2 years looking at ayahuasca for depression. And so these are studies coming out of Brazil, where there were 2 small open-label studies. The first was in 6 patients, and the second was in 17 patients, and they saw significant reductions in some of these common measures that are used to assess depression, which is showing a lot of promise. And this is important for PTSD because depression is oftentimes comorbid with PTSD, so it's kind of important that that is actually showing some benefit in that arena. And then, so I was able to speak at Psychedelic Science in 2013, and I didn't really have any data other than the rationale for why I thought ayahuasca would be useful for PTSD. And, but what I did have was some of the veterans that I happened to be doing ceremony with in Peru shared with me their trip reports, basically. So the experiences that they had and how they interpreted their healing process after taking ayahuasca, and just taking all of the text from their experience reports and putting them in like a word frequency cloud. The main thing that popped up was the fact that they kept referring to it as medicine, and just talking to them individually, they had decreased aggression, they felt their symptoms were gone, and a lot of that has maintained to this day. We keep in contact, and they still seem pretty stable and healthy to this day, which is sort of a testament to me continuing to do this work and seeing how their recovery has continued. I also looked on Arrowwood. So Arrowwood is this really great resource of experience reports and all kinds of information about various drugs, but I looked at in sort of the same fashion. There's all these experience reports that you can look at, and each of them are categorized based on different things, such as whether it was a difficult experience or a mystical experience, or if they had some kind of health problems. And just what I want to point your attention to is the fact that even though there's not a whole lot of people saying that they had bad trips, but they do claim that it's difficult. But difficult doesn't always necessarily mean that it's a bad experience or that it's just challenging, but a lot of really hard work can be difficult and challenging. But they're also rating it just as high as being mystical and these glowing experiences with very little problems or complications being reported, at least from the Arrowwood stuff. And so just looking at a general PubMed search and looking at all the different scientific literature, this is just a comparison of all the different drugs, like Schedule I drugs of abuse that we would call them, that are being researched and reported on in the scientific literature. Obviously, ayahuasca is kind of a minority here. There's not a whole lot, at least when you compare it to things like LSD and marijuana. But if you cross that with whether they're therapeutic studies, actually a larger proportion of these studies are actually focusing on the therapeutic benefit of ayahuasca. So a lot of the science that's coming out is not strictly, but very predominantly focused on what the therapeutic applications of this powerful medicine is. Okay, so now for some of our actual results. So because ayahuasca is sort of it's gaining a lot of notoriety lately in the press, you see a lot of both really good press and you see a lot of really bad press about what is happening. People are either claiming that it's the best medicine they've ever had, or they're claiming that it's causing horrible things like psychosis. There's been a couple deaths associated with it. It's not clear whether people are dying from ayahuasca or rather some complications about the setting. So I think it's really important that we sort of get at what are the risks and benefits of taking ayahuasca, what are the appropriate settings, and how do people with PTSD respond to this medicine. So I was able to get MAPS to fund this small survey. It's an online, anonymous survey. I was inspired by all the different surveys that are happening, looking at mystical experiences and various types of drug use, and I thought this would be sort of a low-hanging fruit because there's not a whole lot of, if any, information about what ayahuasca can do for PTSD, other than sort of making the link and how PTSD works and how ayahuasca works. So I have this survey out. I launched it in June, and let me just walk you through kind of what the survey is. So just some limitations. Obviously, this is a survey. It's not a prospective study. It's not a cross-sectional study. It's retrospective. So I'm having people answer very detailed questions about what their ayahuasca experience was like and how that related to them either getting better or worse from their PTSD symptoms. And And obviously I couldn't control for, there was no inclusion-exclusion criteria other than, have you taken ayahuasca? Do you have a diagnosis of PTSD? So there's obviously going to be a lot of variability in the setting for the population, but it's a good, useful tool just for us to kind of get a sense of what might be going on in this population when they take ayahuasca. So this is just sort of the flow chart of how I included the data that I'm going to show you that I'm analyzing. And so this number is actually a little low because I get more responses every week, and so as of today I actually have like 370 responses, but then not everybody completes the survey, and part of my IRB consent is that the person has to complete the survey to the end in order for them to have consent for their data to be used. And so about half of the people are completing the survey, and of that I have an additional question at the end asking, now that you've taken the survey, do you still want to contribute your data to this study? And most people say they're fine with it, but a few people did decide to drop out, so I don't include those people in the data. And these are just some of the data patterns and the measures that I've been using. I won't go into the detail of what these are in too much of detail, but basically, well, the y-axis here is just the percent of participants, so this is 100%, and what their response rates are for actually us having data for these different measures. And so most people answer the information about demographics, age, religious preferences, whether they served in the military, and then there's details about their ayahuasca experience. Where did they take it? What was the context? What was the preparation and support that you had? What was the experience like? And then what were some of the possible dangers and helpful things that you experienced while you were taking the ayahuasca. And then I have an assessment of what changes they remember having in their PTSD symptoms, if they had any, as well as any changes in drug use immediately after ayahuasca, as well as any treatments they were on before they went to take ayahuasca and how that changed once they were done taking ayahuasca and went home. What were their integration techniques, social support, and then various psychometric scales to look at sort of psychosocial function, including a growth inventory that measures resiliency, a PTSD checklist, which is a self-report measure of PTSD symptom severity, a depression measure, as well as sleep quality. And it's quite a bit of data, and I don't want to just bombard you with graphs, but I do want to go through some of the preliminary results from this, which is more descriptive right now because we really want to boost how many participants we have to maybe 500. Right now we only have, as of now, completed responses actually 170 to really have sufficient power to run any statistics on this. So some basic demographics from this. We have a good gender balance here in this study, mostly half male and half female. I did have a category for people that might not identify as male or female. What their reported PTSD status was. So I had two assessments of PTSD in this. One was, have you ever been diagnosed with PTSD by a clinician? And so they could either say no, they haven't, yes, I have a current diagnosis of PTSD, or yes, I had PTSD in the past, but I'm currently in remission, so a past diagnosis of PTSD. And then most of the participants were civilians, and most of the participants were white. In terms of the location of where people were taking ayahuasca, it seems the predominant facilities are those that are in South America, because unfortunately, if you don't want to get into legal trouble, you don't want to navigate all of that that's happening and that's controversial in the United States, you have to go down to South America because it is legal in Brazil and Peru. But there are still a lot of people that are taking it in the United States as well as outside of the Americas like Europe and Australia. And then also it seems that most people in terms of integration types of therapy are doing meditation or yoga, and some people doing individual therapy and some other forms of therapy that were sort of these open-ended questions that I'm still getting at what those other individual forms of integration are. So getting into what this is actually doing for their PTSD symptoms. So again, this is very preliminary. I don't want to make any conclusions or anything about this because it's a survey, but we are seeing some fairly consistent patterns. And so the top graph up here is what was their drug use changes or substance use changes immediately following ayahuasca. So about 1 week to 1 month after taking ayahuasca, did they notice any changes in their substance use? And it was a categorical scale where I said, after ayahuasca, how did your alcohol use change? Was it much more, a little more, no change, a little less, or much less? And what you can see is that most of these bars, these are the proportion of participants in each group for each drug or substance. And so mostly people are showing that they are reporting that they have decreased alcohol use decreased prescription use. There is some increased psychedelic use, which is kind of interesting. I wonder if that's part of some people's integration process. It'd be interesting to look at that in detail. Regarding their symptom changes, so here it's sort of the opposite, where white is an improvement. So all of their symptoms, so these are the various PTSD symptoms that are reported in some of the clinical assessments of PTSD. So we have things like re-experiencing, avoidance of things that might be re-triggering or re-traumatizing, negative thoughts, hyperarousal, depression, and suicidal thoughts. And it looks like across the board so far we are seeing a trend of, much better improvements in some of these symptoms, both 1 week and 1 month after taking ayahuasca, with the caveat that these are people that are just trying to remember back to that time frame after they took ayahuasca, whether it was a week ago, whether it was 3 months ago, whether it was 10 years ago. But generally across the board, we're seeing most people saying that they have a decrease in most of these symptoms, which is promising. So like I said, I had 2 different measures of PTSD. One was just, have you ever been diagnosed with PTSD by a clinician? But then I also had a PTSD checklist, which is the self-report measure. And I don't want to get too much into the details of this, but I was curious if potentially people would think they had PTSD, or maybe they didn't, or they had never been diagnosed because maybe they didn't have access to somebody who could diagnose them with PTSD, or didn't want to be diagnosed with PTSD, so they just never actually got assessed. I don't know if that's the case here, but it's just kind of an interesting way to tap into what they report as being diagnosed as, and then what are their actual current symptoms at the time that they took the survey, according to this PCL checklist, this PTSD checklist. And so for the people that don't have PTSD or reported never being diagnosed with PTSD, about 20% actually did test positive when I scored it according to sort of the standard guidelines of how you would actually diagnose somebody using this measure. For people that claim to have a current diagnosis of PTSD, actually some of them were no longer showing symptomatic evidence that they would be testing positive to have PTSD, according to this. And then there was sort of like a mixture of half and half for those that said they were in remission, but then some were still testing positive as having PTSD. And so now I've kind of grouped these responses based on those 2 criteria. So looking at the PTSD checklist, so what are their symptom scores now at the time of taking the survey, and how they're actually reporting upon their ayahuasca experience. And so one of the questions I had nested in there was, what aspects of the ayahuasca experience did you find either dangerous or helpful, both during and after the experience? And for the most part, you see that people, so blue is, blue is no, they didn't think it was dangerous or helpful. Wait, no, they didn't think it was dangerous during or after. And then red is down here, where you see most of the participants find that there's some aspect of the ceremony that's helpful both during and after. Regarding who thinks there's some dangerous aspects of the ayahuasca experience, there does seem to be a higher trend in the people that had a positive diagnosis of PTSD, and I still want to look into what the exact descriptions of what those things might be, and that sort of maintains in some of the aftercare that they have or have not received. And so taking some of this information out, so these were a lot of open-ended responses that basically I have about like 30 pages of text trying to decipher what all of this means. And so the quickest way for me right now, just to kind of get a general sense of what's happening, is to do these word frequency clouds. So I took all the text from what people reported to be dangerous during their ayahuasca experience, and then that's at the top where it's everybody, and then I broke it up between those who didn't have PTSD and those who did have PTSD. And the general sense I got from reading these responses was that people felt that if they weren't with somebody that was experienced or knew what they were doing, they felt that was really dangerous. They also thought it was dangerous if they didn't have somebody to help them, like walk to the bathroom, for example, or just having that person there to monitor them and make sure they had the right amount of support. There was also a lot of people that didn't like the fact that they were in a room with other people, and they felt a little triggered by other people's processes and purging and whatnot. So that seemed to be pretty triggering for some people. Regarding what they found to be helpful during the ayahuasca experience, it seemed that most people liked to know that they had an experienced shaman. The music was sort of a key aspect of this. You see this sort of represented, in all of these things, and just really having that safe, supportive environment with somebody that was very knowledgeable, and all of the different comforts and things that accompany being able to go deep and feel safe and supported. And these are things we kind of already know, but it's nice to see it confirmed in their reports. Regarding things that people thought were dangerous afterwards, were things like not having enough time to recover, being sent home, having to drive and not feeling like they were ready to drive home, and not having anybody to talk to afterwards. Whereas the things that they thought were helpful were obviously having community support, having a group of people to talk to, having professionals that they could integrate with, and this was a very prominent theme in what people found to be really helpful in order to process their ayahuasca experience. And so looking towards the future and towards the horizon, which is the theme of this conference, we're actually trying to plan a clinical trial in the United States to look at ayahuasca for PTSD. This isn't an easy task. We need to get all the DEA and FDA approvals, but I'm in the process of writing a protocol that I'm adapting from the MDMA for PTSD clinical trial protocol. We're going to have, several 2 or 3 experimental sessions where we administer ayahuasca, and then immediately after that we'll have some integration sessions with each patient, and then we'll do really intense 3 months of integration after the final ayahuasca ceremony in order to make sure that they can process that and really, really integrate that into their life. Because just talking to some psychotherapists that sort of do integration work, they recommend that having weekly integration for at least 3 months after some of these really intense experiences is really beneficial. And so hopefully we can get this moving forward, and I really look forward to where this is going. I really want to publish the results of this survey just to kind of get the information out there so there's more that we can cite about this. The first paper I'm hoping to write up with some consultation from Via Labate is going to be more of like an anthropological descriptive paper about some of these responses that people have in the different settings. And then hopefully if we can get at least 500 total participants completing the survey, I'd like to do a more quantitative paper that we submit to one of these like higher impact scientific journals where we can run stats and hopefully make some conclusions that we can draw from and use as rationale to convince all these different regulatory agencies that we can actually do a clinical trial on this. And I just want to thank all you guys for coming. I want to thank Horizons for inviting me to give this talk. It's truly an honor. I'm really happy as sort of this new person in psychedelic research. It's not my background, but it's something I'm really hoping to integrate into my career moving forward. Obviously, I want to thank MAPS for their ongoing support and mentorship and collaboration and funding for the survey. I'd like to give a special thanks to Tim, who's local here. He's actually been hosting me while I've been staying, and I'm really grateful that he's letting me stay in his house while I'm here so I can present to you. And then our ayahuasca working group. So this is a group of people. We basically have calls every month to discuss the development of the ayahuasca for PTSD clinical trial protocol. And it's really great to have, Rick's feedback, because he's just obviously kind of like a pioneer in this field of trying to get these Schedule I drugs into clinical trials. Bia Labate, who's you'll hear from next, who's just kind of the authority in the ayahuasca world. She's amazing to have as a guide and a mentor in this. And then we have 2 psychotherapists that we're hoping to be sort of the therapy team on this trial, who are licensed therapists who also have experience taking ayahuasca themselves, which I think is going to be an important component for people that are going to be facilitating this as therapy. And Ali Fiducia, who's the clinical trial coordinator at MAPS. And I'll take any questions.
Yes. Jessica Nielson. Thank you, Jessica. So we have questions. Anyone? We have someone right here.
So my question for you is about the ayahuasca itself. So ayahuasca is a very complex brew. It has a lot of things in it, and that can you, I'm sorry. So my question for you is about the ayahuasca itself. So it's a very complex brew. There are a lot of things in it, and that varies a lot from region to region. So I was just wondering if you have any interest in any particular ayahuasca component, and if you have any data available in these surveys that you're doing to look at the different kind of preparations and how that impacts people's responses.
That's a really good question. I actually haven't looked at the different components, at least from the survey, but we want to adopt a model of using the constituents that have been used in some of these therapeutic models, like the ones they're using for the depression studies in Brazil. We're still trying to determine whether we want to use a liquid form or the freeze-dried form. They have different pharmacokinetics and experiences. So right now we're leaning towards a standardized tea that we can test using, like HPLC and things like that. But we're trying to determine whether we want to import it from Brazil, from the people that have already done those studies in depression, or whether we want to find someplace locally that has a DEA Schedule I manufacturer's license that we can get it from, and that the FDA and the DEA can approve, because we really need to find that source, open up a drug master file, and then get an IND and all that stuff.
In your study design, and assuming that ayahuasca will become a legal medicine, what setting for administration do you think would be most effective to avoid re-traumatizing those suffering with PTSD? Like the traditional setting, there's some people that think that's a requirement for the medicine to work. Or do you think something set up like the psilocybin studies or the MDMA studies, for example, would work?
So I'm envisioning a treatment facility that's, located near, like you want to have the appropriate medical equipment in the next room should they have some kind of physical cardiovascular complications. But I would like to set up the room to be kind of indigenous and to keep the traditional context. This is something we're actively discussing. It's a bit back and forth. Some people think we should have just a straight clinical setting. Some people think we should really preserve the traditions. It seems from the responses from the survey, people like to have, like the Icaros specifically, they like that music. They like having a sense of connection with sort of the traditions of the plant. I know personally when I took it, I actually was able to take it in the jungle, and I felt a deep connection to the plants. I just felt like I was part of this network, and I don't know if that is also experienced when people do it in, a living room in the United States or what, but I'm leaning towards a more ceremonial, traditional type of setting, but with sort of Western precautions in place.
Any chance you might compare those conditions? Ayahuasca alone versus ayahuasca in ceremony?
Pardon? Can you say that?
Is there any chance you might compare those two conditions, ayahuasca alone versus ayahuasca in ceremony?
So we want to, because PTSD patients need a lot of monitoring and care, and because we're getting a lot of reports of people saying they don't like having other people around them, I think we'd want to do one-on-one sessions, having a co-therapy team and just one patient at a time.
I see. Other questions?
I have one here.
Gotcha. You're following up on the first question about the various components of the ayahuasca group. It's my understanding that the ayahuasca vine, in and of itself, without the traditional psychedelic components, may have some real significant therapeutic value. Mm-hmm. And I'm wondering if there are any, given the hurdles to doing research with psychedelics, I'm wondering if there are any plans or anyone envisions doing studies using merely the vine by itself without the DMT containing components.
That's a good question. Right now, probably not. Probably looking at the combination of the admixtures, although it would be, ideally if we had enough money and we can get approval for a sufficient number of patient enrollment, it would be nice to sort of have different combinations to see what's actually the therapeutic component. But for an initial study, you got to keep your sample sizes fairly small, so I think we want to stick just with the traditional combination. And then maybe when we phase up, there might be options to do sort of like side studies about that. But there is some evidence in the animal literature about this, especially with harmine. I think somebody talked about this yesterday, showing that it can be effective for preventing edema and traumatic brain injury in animal models. So, it'd be interesting to look at.
Other questions?
You say it's very important after have an integration period. What is the significance of the integration part when we take ayahuasca?
I think the significance of the integration is that, especially for someone with PTSD, if it's bringing up a lot of triggers and it's sort of re-exposing them to their trauma, because like I said, it's kind of like exposure therapy experientially. And so when that's the case, you really need to have support. You need to let them make sure they can process that so it doesn't just become another traumatic experience. And so I didn't show this, but there was one participant who didn't have any history of PTSD, but her experience, because she didn't have any support afterwards, she actually felt that that was one of the most traumatic experiences of her life. So I really think it's important to have that so that they can process and really make it something useful in their life.
I had a question about the word clouds. I noticed that in both the helpful and dangerous categories that the word time was prominently mentioned. Would you be able to comment on the context of time in those responses and what they meant by that?
Right. Okay, so sometimes time is just like some of the time, da-da-da-da-da, there's a lot of that. But there's also people saying that they wanted more time to recover, more time to let the effects wear off so that they could leave. Because a lot of the times people were, if it's like a weekend ceremony I'm gathering, they were basically forced to drive home when it was done and they didn't feel physically ready to do that.
One more question over there.
Some of the people I know who have experienced ayahuasca have taken it multiple times. And I was wondering if in this survey you were just dealing with people who had just taken it once, or if they had taken it several times, and if you have any sort of instincts about like an optimal number of times for your research.
Yeah, so you mean what would be a reasonable therapeutic number of times, or how many times people have taken ayahuasca?
Both.
Okay. Well, so for the trial, we're thinking of 2 or 3 sessions. And hopefully they would be people that have never done ayahuasca before. For the participants of the survey, most of the people reported taking it 10 or more times.
Wow.
And so I just had a 10 plus category, and that one had the most responses. And some of those were like 300. They would just write in on the side. So I think, maybe people that are in the Daime church, Santa Daime, they do it every month. So they're obviously pushing that number up.
Thank you.
A question over here. Sir.
Yes, when we talk about setting, it's often the space. But in my experience with ayahuasca, the chanting and the particular chants and even the intention of the song leaders is kind of almost like the critical setting. So even whether you're doing it in the jungle or you're doing it in the living room, I'm thinking one time when I did it in the living room with Santo Daime Church, but it was a particular work, and the hymns were so critical for the effect of the healing that was supposed to be brought forth. So I'm wondering if sound as setting, how you're dealing with sound and melody and chant, and even who leads that, or if it's live or recorded.
Yeah, people didn't really get at the specifics of what type of music. They just generally said music, other than saying Icaros. So those traditional sort of, Peruvian, the Shipibo songs that are sung in South America, that was one of the more prominent things. Other than that, it was music.
So I have a question, because we hear a lot about MDMA for PTSD, right? So my question is, I guess, what's the benefit of using ayahuasca for PTSD over MDMA? And it might be too early to kind of say, but I wonder if there's a different kind of PTSD, or people that maybe with some more resistant cases.
It's a really good question. It's actually something I've been thinking about, because I was wondering if some people would need, if somebody had really complex PTSD, really severe PTSD, ayahuasca may not be appropriate for them, because it's kind of like exposure therapy, and in that instance it can be re-traumatizing, so MDMA might be more appropriate. And I don't know that you would want to pre-treat with MDMA and then do ayahuasca, but I would say for now we would want to have people that have less severe PTSD taking ayahuasca and more severe PTSD taking MDMA.
I think we have time for one more question.
According to my experience, the longest and the more rigorous the diet is, the more effective is the ayahuasca. What kind of diet do you have in mind for these patients?
I would recommend the classic dieta that most of the shamans recommend.
What's a classic?
Huh?
What is the classic dieta?
Well, so this is not my area of expertise in terms of that. Yeah. Yeah, I would say like no salt, no meat,
Repeat
no
the
sex.
question. He's saying sex or no sex, alcohol or no alcohol. What's
Well, I would
the
say
regimen?
no meat, no salt. I don't know how I feel about the sex thing, but if it's gonna drain you energetically, then maybe it's not a good idea. I don't know how I feel about that one. But also, not taking the contraindicated medications as well. But I mean, a lot of people did say that the diet was helpful, that specific diet, both before and after.
Well, join me in thanking Jessica Nielson. Thank you so much, Jessica. So, thank you, Jessica.